Dear colleagues, my name is R.A.Bodrova. I am the Chief of the Rehabilitation and Sports Medicine Department of the State Medical Academy of the City of Kazan, the branch of the FGBO Russian Medical Academy for Postgraduate Education, and the Chief Specialist of the Ministry of Health of the Republic of Tatarstan. Today I will speak about medical rehabilitation and non-pharmaceutical treatment options for patients who have had coronavirus infection COVID-19. All of us are definitely aware of the circumstances which all countries are in, of the number of COVID cases, and of the issues faced by the patients all over the world who have experienced COVID-19. In that regard, I would like to put an emphasis on common complaints addressed by patients. A very important aspect is an early identification of any emerging issues that the patients may experience, and a possibility of their correction, firstly of course in a non-pharmaceutical way. At the same time, I can't ignore the pharmacotherapy either, because as you know well, not only the adherence to the daily routine, the rest mode, but also special medications enable a patient to maintain the quality of life for as long as possible, as well as to prevent complications, such as the thrombosis. When we speak about the consequences of the new coronavirus infection, we have to focus attention on the main symptoms. 3 to 4 weeks after the treatment in an infectious diseases hospital, the medical care in outpatient clinics or at home, the principal patient's complaints are the generalized weakness, the fatigability, decreased performance. For some reason, a patient is irritable, he feels the lack of energy, he starts suffering from the joint pain or the back pain. He wants to be active during the whole day, but can't do that. So we always recommend to our patients that they should return to their professional and social routine in a gradual and consistent way, and that they should strictly follow the treatment plan. Оно должно быть обязательно строго выполняемым по и времени тех или иных процедур. Speaking about a set of rehabilitation activities, especially those that are done at home, we have to remember that we cannot leave a patient alone, face-to-face with his problem. Speaking about early rehabilitation, we remember that all the rehabilitation activities are to be implemented in compliance with the provisional clinical guidelines. At this moment in time, a group of rehabilitation physicians of the Rehabilitation Physicians Union of Russia, headed by Galina Eugenievna Ivanova, has already developed the next edition of clinical guidelines, which will be shortly approved. Speaking about different rehabilitation methods, we always refer to those clinical guidelines. I want to point out that such a range of non-pharmacological therapy, which is presented in the Russian clinical guidelines, by the way the 11th edition of which has been reapproved by the Russian Ministry of Health, cannot be found in other countries' clinical guidelines, for example in those of our Chinese or Spanish colleagues. It's important to note that rehabilitation at the first, second and third stages integrates the activities that prevent post-COVID complications. We have to clearly route a patient from the first stage of the medical rehabilitation to either the second stage inpatient or the third. Speaking about the second stage of the medical rehabilitation, I want to point out that rehabilitation physicians of our country were among the first who started actively using physiotherapy methods in the framework of rehabilitation activities. Applying those methods based on clinical guidelines, fortunately, we have not observed any side effects and have improved the quality of life of our patients. We used classical methods of the physical therapy, such as the light therapy, the low-frequency pulsed electromagnetic field therapy, the hyperbaric oxygen therapy, and other methods, which were actively used by our colleagues in May last year. I want to remind you, colleagues, that the main rehabilitation methods are physical therapy exercises, breathing exercises, the exhale with the resistance exercises, Frolov breathing simulators, and definitely the inhalation physical therapy technology, which allows to use different medications, depending on the clinic, in order to ease breathing. Discharging a patient from an infectious diseases hospital after successful treatment made in the second stage, we have to either give clear recommendations for the outpatient treatment or for the sanatorium treatment, or let him stay at home under the supervision of a doctor.
Либо мы направляем его на санаторно-курортное лечение, либо оставляем под наблюдением уже в домашних условиях.
The provisional clinical guidelines give clear instructions for physical therapy exercises, depending on the severity of patient's conditions, and the score measured by the Borg scale, MMRC shortage of breath scale. We recommend physiotherapy methods. I want to remind that thanks to the Russian Rehabilitation Physicians Union, we have got a clear algorithm of management of patients since last year. Since June 2020, we have been engaging actively in outpatient rehabilitation of individuals that have had pneumonia caused by COVID-19, and thanks to the guidelines, we started using our methods actively from the 15-16th day, and got outstanding results, which were presented in the Scorpa System Journal. These are primarily the methods which proved themselves during the current year, namely, the low-frequency pulsed electromagnetic therapy applied directly on the lungs projection, which we will discuss in detail later, and surely light therapy, laser therapy, magnetolaser therapy, the polarized light technology, the inhalation physiotherapy with bronchodilators, expectorants, mucolytics, the hyperbaric oxygen therapy, or the normoxic barotherapy, the methods which enable to improve the drainage lung function, the electrotherapy, the sinusoidal modularized currents, etc. Taking into consideration the world experience and a high interest in the studies of pulsed electromagnetic field therapy during the last 15 years, we began looking into these studies very thoroughly. And here is what we discovered. Upon thorough examination of the role and health impact of pulsed electromagnetic field therapy, both the Russian scientists and the scientists from Canada, Germany, Israel revealed a very important pattern. When we speak about the action principles and the application points of low-frequency pulsed electromagnetic therapy, we bear in mind that the electromotive force is created in blood and lymph flows. So application points are blood and lymph, current-carrying fluids. While considering those studies, we understood that the main pathogenetic mechanism of impact of the low-frequency pulsed electromagnetic field therapy might be attributed to the change of volumetric charges on the erythrocyte's surface. And the impact of the low-frequency pulsed electromagnetic field therapy on blood fluidity, on its microcirculation, on central nervous system, on peripheral nervous system, on the state of internal organs, is unique. We recalled our experience of the University Games held in 2013 in the city of Kazan, when we were surprised at the fact that the majority of sport teams members and doctors of the foreign teams asked that we should prescribe their athletes precisely the low-frequency pulsed electromagnetic field therapy in case of physical exhaustion, pneumonia which developed after a long stay under an air conditioner, as well as in case of the joint pain. We had to use not only foreign pulsed electromagnetic field therapy devices, but also the Russian ones. We arranged additional beds in physiotherapy rooms and began to actively use pulsed electromagnetic field therapy both in Russian, Chinese athletes and in athletes of CIS countries. Well, and when we touch upon the mechanism of action, we clearly remember that the low-frequency pulsed electromagnetic field therapy, firstly, is one of the well-studied methods. Secondly, it is the most physiological one. Thirdly, it has a very precise mechanism of action, physicochemical, neuro, reflex humoral. And the most important are its favorable treatment effects. What are the main treatment effects? Firstly, it is the impact on the microcirculation, blood flow improvement, swelling removal. To speak about swelling removal means to speak about anti-inflammatory effect because there are 5 signs of acute inflammation. They are associated with these symptoms. When we produce the anti-swelling and anti-inflammatory effect, removing or reducing the edema, we also reduce the pain syndrome, therefore we improve patients' functions and the quality of life in the future. Thus, the main clinical effects, to just briefly accentuate them, are anti-inflammatory, anti-swelling, the improvement of microcirculation, the improvement of reparation and regeneration processes. A very important factor is that this therapy does not provoke fibroblast activation, in contrast to another physiotherapeutic method, for example, electric field, UHF therapy. This is extremely important, in particular in the period of the new coronavirus infection. In other words, the low-frequency pulsed electromagnetic field therapy stimulating the reparation and the regeneration processes does not lead to fibrosis, what is of the utmost importance. And the second very important aspect is that the low-frequency pulsed electromagnetic field therapy, having resorption effect and improving microhemocirculation, improves mobility, organs function, and having the impact on the nervous system, it has a sedative effect and normalizes the vegetative nervous system. In what cases should we restrain from usage of low-frequency pulsed electromagnetic therapy? In other words, what contraindications exist? Firstly, it's blood hypercoagulation when a patient is prone to bleeding or complains of nosebleeds. Also, it is high sensitivity to magnetic storms or magnetic disturbances. It can be very patient-specific, but if a person has a very clear and well-expressed reaction, we don't use this type of therapy. Naturally, on a day of magnetic disturbances, we should either reduce the dose of therapy or cancel it for 1 to 2 days. Besides, as a limitation, I will point out hypertension, when patient's blood pressure is lower than 90/60ths. General contraindications for the low-frequency pulsed electromagnetic field therapy are expressed heart rate disturbances, the blood pressure higher than 180/100, and what I want to particularly accentuate, the diabetes mellitus. And importantly, diabetes, high blood pressure, 160/100 or 170/100, were one of the grounds in favor of low-frequency pulsed electromagnetic therapy in patients that have had coronavirus infection. Every patient got a rehabilitation diagnosis. As per ICF, main impaired functions were identified, and the rehabilitation program was recommended. We develop an individual rehabilitation program aimed precisely at the improvement of lung functions. These are improvement of the breathing function, ventilation, lung volume and drainage function, sputum loosening, and reducing cough pain. I want to draw your attention. In compliance with the new regulation N788H, which entered into force as of January 2021, all of us, colleagues, have to make a rehabilitation diagnosis for the patients that have had coronavirus infection, to define the rehabilitation goal, and, most importantly, to measure the extent of accomplishment of the goal when the rehabilitation process is nearing the end. Many physicians ask what to do, question, as there aren't enough specialists. So how can they cope with such a big number of patients undergone the new coronavirus infection? If the number of physical rehabilitation physicians does not allow you to make an appropriate coverage of patients in 3 to 4 rehabilitation departments, you may use our experience. To increase therapy coverage of high number of post-COVID patients, last year we recommended to provide the medical rehabilitation assistance in any healthcare facilities equipped with physical therapy rooms in the format of a daytime pneumonia-profiled inpatient care, provided of course that they had technologies and specialists to help normalize impaired functions. Well, we were focused on the physical therapy rooms, on the physiotherapy methods, which are accessible and are easy in use, which can in fact be used in practice in any central regional hospital, and even in paramedical and midwifery stations in outpatient conditions. It is very important that we may use a range of the high-tech rehabilitation means in our National Medical Research Centers, NMRC. These are 2 leading head NMIs located in Moscow. We may use the facilities of the rehabilitation departments of the 3rd level as a Rule-1-2 centers in each region of Russia. We may use the rehabilitation department of the 2nd level, and this is our medical rehabilitation department. We can use facilities of the 1st level, for example physical therapy rooms, which will allow you to maximize the coverage of post-COVID patients, and most importantly, to improve the quality of their life. We may share experience with each other, and we consider it very important. Every medical institution which provides the medical care has its own experience. Let me share more details about our experience, which we gained throughout the year of working with patients that have had pneumonia associated with COVID-19. We can tell in detail about the observations of patients. We achieved an outstanding result on the basis of over 200 patients observed in 2 medical facilities of our region that carry out medical rehabilitation. We conducted a placebo-controlled study in patients undergone pneumonia caused by COVID-19 who were treated precisely with the Russian ALMAG-02 device. We impacted the lung projection area at the 16 to 18 day after the discharge from the red zone or from the infectious diseases department and assessed such parameters as the Borg scale, the shortness of breath level, the 6 minutes walking test, well-being, activity, mood as per the Spielberg-Hanin test and other parameters before and after the rehabilitation. Upon result analysis, we were surprised with how productive the study appeared to be. It showed not only the decrease of the breath impairment level from 38% to 48%, the 1,5-2 times decrease of the shortage of breath, the increase of chest excursion from 42% to 48%, the improvement of the well-being, the activity, the mood, the sleep function in 89% patients. Patients were divided in groups. And, what I want to specify, we implemented a double-blind placebo-controlled clinical trial. In other words, there were 2 similar devices, one of them placebo. Patients to whom placebo devices were applied thought that they were treated with the low-frequency pulsed electromagnetic field therapy, but in fact they were placebo-treated. They did not get the treatment with the low-frequency pulsed electromagnetic field therapy. After the patients have been examined by all the members of the multidisciplinary rehabilitation team, MRT, we prescribed a course of the low-frequency pulsed electromagnetic field therapy with ALMAG-02 on the projection of affected lungs. The first therapy procedures were carried out at the intensity of 10 to 20 millitesla for patients of 60 to 65 YO around 10 millitesla, and later 20 millitesla, for the duration of 10 to 20 minutes. After the course of treatment, all the patients were examined by MRT members. All the scales, tests, assessments were done, including the spirometry, the chest excursion, and the computer tomography in dynamics. Besides, we discovered that in about 92% patients who actively passed the complex of the medical rehabilitation, the quality of life improved. To summarize, the analysis shows that the individual rehabilitation program, provided that the goal has been clearly set, and each member of the multidisciplinary rehabilitation team is actively involved, has a positive result. When we act in compliance with the clinical guidelines, when we use medical technologies and develop a structured rehabilitation plan. All the patients who participated in our observational study, in its current cycle, got the low-frequency pulsed electromagnetic field treatment with ALMAG-02 in both groups. We put induction coils directly on the lungs projection. It is most important that the projection of the lungs was the area of treatment. The traveling pulsed electromagnetic field treatment was prescribed as follows: traveling field from the right to the left at the intensity of 20 millitesla. Time of treatment was 10 to 20 minutes. Every patient was advised about potential sensations they may experience during the treatment procedure. At the same time, I want to say that the advantage of this therapy is that it does not cause those potential negative sensations which may be caused by other treatment methods. Well, all the patients were lying on their front, prone position, in a comfortable pose, while they were treated during the time recommended by a doctor. And they shared the sensations they felt before and after the pulsed electromagnetic field treatment course. Taking into consideration the mechanism of action of the low-frequency pulsed electromagnetic field therapy, its treatment effects, such as anti-inflammatory, anti-swelling, the improvement of microcirculation, the improvement and the stimulation of the reparation and the regeneration, we treated all the patients with ALMAG-02. The coils line was placed directly on the back of the patient on the projection of affected lungs area, taking into account that the pulsed electromagnetic field penetrates up to 4 to 6 centimeters. That is why, according to the X-ray computer tomography, X-ray CT, results, and the stethoscope examination made by our specialists, affected zones with, for example, dry wheezing precisely in affected lung lobes were identified. The coils were placed so that those affected zones were just under them. Focusing attention on the treatment effect of the pulsed electromagnetic field therapy and taking into consideration the electromagnetic field action, we recommended the traveling pulsed electromagnetic field from the right to the left at the intensity of 20 millitesla, based on foreign studies. And the time of treatment procedure was 10 to 20 minutes. Normally, the course of treatment consisted of 10 treatment procedures. The treatment course was prolonged to some patients up to 15 to 18 procedures, in particular to those whose X-ray CT score was at 4. After the treatment, based on tests and scales, the examination of subjective and objective state of each patient, we analyzed the dynamics during our course of the medical rehabilitation. I want to accentuate as well that in addition to the fact that the treatment procedure is simple and it is recommended not only in our physiotherapy rooms, but also in the rehabilitation departments, the said method is advantageous because it does not cause any negative sensations in patients. It is well tolerated, it is easy in use, and the most important is that it showed the effectiveness of treatment. We can use the low-frequency pulsed electromagnetic field therapy to treat different diseases in the acute or subacute or chronic, or recurrent stage, any of these from which a patient undergone new coronavirus infection suffers. And I want to point out that we can use different types of the pulsed electromagnetic field therapy equipment. It can be, for example, Polis 1, Polis 2, Polymag, which uses all 4 types of magnetic fields. We can use devices locally, applying them, for example, for the joint pain, developed as a consequence of coronavirus infections. In this case, we can work using such devices as, for example, Almag 01 or a portative device master. What is very important is that we can combine the electromagnetic therapy and the light therapy. If a person has an exudative arthritis, we may use the electromagnetic therapy and the blue light therapy. In case a patient suffers from the pain, joint stiffness, but doesn't have exudate, swelling, we may use a combination of the electromagnetic therapy and the red light therapy, or the red color range, or the orange color range in order to provide the resorption effect, to remove the spasm of periarticular tissues, to improve the range of motion. Taking into consideration such a numerous range of magnetotherapy equipment, we may choose a device, a technology, which will be pathogenetically grounded for a patient, and which will represent an individual magnetotherapy program providing the utmost effect. The preliminary conclusion which we made was, this method is not only safe, highly effective, and easy in the treatment procedure execution, but also it is highly accessible, as in accordance with the procedure of the provision of medical care, and with the clinical guidelines. This technology is included in all the standards and can be implemented both in the physiotherapy rooms in outpatient clinics and in departments of rehabilitation centers, which provide the medical care assistance at the second, the third and the fourth stages of the medical rehabilitation. That's why I think that during the next period and the next year we need the exchange of the experience between colleagues not only in our country, but also near and far abroad. A high interest in our studies shown by European countries, India, Thailand, UAE will demonstrate to what extent the technologies that we use for the medical rehabilitation of our patients will actually be implemented.
Те технологии, которые мы используем для медицинской реабилитации наших пациентов, действительно будут
And most importantly, how these technologies will show their effectiveness in both life quality improvement and reducing the risk of complications. Thank you for your attention.